Hello, I'm Dr. Kathryn Hayward. Welcome to this podcast with Dr. Mimi Choi. Dr. Choi, Mimi, is someone that I met about 16 years ago when she was a medical student at Harvard Medical School. I was teaching a course called Clerkship in Primary Care, and Mimi was my student. And we developed a very close relationship during that course. It was a course that began in January of second year of her medical school experience and went on for 9 or 10 months. And she would come to my office where I was seeing patients once a week. And she had certain assignments that she needed to complete, especially one where she had to choose a patient and write something about her experience with that patient. And so we thought we would start this podcast by having you hear what it was like for her as a medical student to come to a doctor's office for the first time and spend that kind of intense time with a practicing physician. It might give you an idea of what it's like from the point of view of the physician and of the medical student when you yourself go into a doctor's office. Hi, Mimi.
Hi, Kathryn.
So what was it like back then? You were a second-year medical student and you got assigned to me.
Yeah.
What happened?
I feel like what I was really appreciating about that transition is that the first part of medical school, especially in the United States, is that we spend a lot of time in the classroom learning about all of the diseases, how the body works, how the body breaks down. And then when we move into our practical experiences, our clerkships, we see it all in real life. And I was really struck by a lot of the patients that came into your internal medicine primary care practice. These adult patients would come complaining of different problems with either their chest or their stomach or headaches. And as much as in our classroom learning, we were taught, oh, it's all just how the body breaks down. What really struck me working with you during that year was that a lot of that was actually unfiltered, unprocessed emotions or experiences that people had that were showing up in their body in ways that they didn't know up here, but their body knew in different parts of their body.
That's such an interesting observation. What is it when we get sick that we are learning from the experience of illness? Our body often is the thing that gets sick, and that's the reason that we go to a doctor. We have a certain idea of why we're sick or what's going on, but many times there's not a union between our idea of what's making us sick and what our body is experiencing. So what insights do you have about that?
Well, I just was appreciating how, that was 15, 16 years ago. And now we have so much more language around that, whether it's toxic stress or adverse childhood experiences. And really, everybody has a better appreciation. I think we're moving as a society towards the body knows. And I really remember one of the patients that I followed for that year. He was a middle-aged man. He had children who were school-aged, and he came to us because I think he had some chest pain that he couldn't resolve, and he'd been worked up, in the conventional Western medicine way, where his heart rhythm was fine, his physical exam was fine, but he wasn't fine. Mm-hmm. And that was to me really striking as a medical student to be like, well, the book part of how we would think about him says he's fine, but he's not fine. And as doctors, we can see he's not fine. And so what do we do now?
And what did we do?
Well, and that was the magic of being with you, because I was a very lucky medical student. I had a very special experience where you being who you are and the kind of medicine and integrative holistic approach you had, we would see patients at Massachusetts General Hospital. where much of Western medicine was discovered and established. And then we'd walk across the street to Beacon Hill, where you had an integrative somatic medical practice where we would help people unlock what was inside that maybe they didn't know about here, or they didn't remember, but there was something that their body was holding on to. And it was really powerful to just watch the release of energy that had been stagnant in their bodies and just see how transformative that could be for folks.
Having a little emotional moment here. Never had somebody describe it that way before. You'll get to do some editing of this.
No. I'll leave the full clip.
Whew. Hmm. I wasn't expecting this in this little experience we're having together. There was an aspect of being a physician at Mass General Hospital and Harvard Medical School that didn't fit with who I am and didn't fit with how I think about health and healing. So this walk across the street that you're talking about was because I had a home there on Beacon Hill, and we created a practice, integrative health practice called Odyssey, where I had this luxurious experience of at least 2 hours with patients, as opposed to the 7 minutes that we got in the office. And we could really dig into the roots of why people have the health challenges that they have. And I had forgotten that I invited you into that.
It was such a powerful and formative experience for me as a medical student. And I do think that's that's 100% why we connected, because I think you and I both, even though we've practiced, in very traditional spaces of medicine, I came from a family tradition of traditional Chinese medicine. My parents still to this day very rarely take any kind of Western medicine unless they have to. And so knowing that there was so much more outside of just pills and tests and procedures, and trying to navigate that in a especially back then, I feel like medicine has made a lot of progress. But 15, 16 years ago, people were still like, well, this is a thing, that's it, book's done, book's closed. And to be in a space where we both could appreciate there's so much more magic in medicine than we realize. It's not just about what's in front of us, physically. That was really, really powerful and special for me.
What was it like to come from your Chinese parents, that childhood, their perspective on health and healing, and go to Harvard Medical School?
Yeah, I mean, it was like entering a different world, honestly, because I think as many traditional medicines, not just Chinese, but I feel like as I've learned more about native medicine as well, there's an appreciation for how our health is everything, so there's food as medicine is a big part of traditional Chinese medicine. And then there is a lot of appreciation for just the energy and the meridians, and accepting that there's a different system that maybe we can't see or feel, but it's part of our bodies. And so I remember actually when I was learning about pharmacology in my second year of medical school, taking a step back, when I was in college, I was really curious about why back then people really poo-pooed alternative medicine. Like people would say, oh, well, acupuncture is just a little add-on, or, oh, we don't really know how that works, so clearly it can't work, and really studying the cultural and political influences for why that might be. And so then to step into the Western medical world, and I remember in my pharmacology class learning about how we actually don't know the mechanism for Tylenol, for acetaminophen. Nobody actually knows how that stops pain. To me, that was wild, because I was like, how can we be okay putting this magical pill into people's bodies that can be toxic to the liver and not know how it works, but to poo-poo through thousands of years of a cultural tradition where many people have experienced benefits from other healing approaches, whether it's herbs or needles through acupuncture or massage. I think it just really brought into question for myself both an awareness of the limitations of how we define medicine and treatments in Western medicine, but also just recognizing there's so much more that adds to our health than just what we think of as the medical system, as what a doctor brings to a patient.
So having that kind of curiosity and insight when you're in a place like Harvard Medical School and Mass General Hospital and all these other hospitals that are associated with Harvard, how did you reconcile your curiosity with what was being expected of you, what was being taught to you, what you were being tested on?
Yeah. I mean, I feel like I was leading a bit of a double life, much as you were, in a way. I even remember I was proposing to do a study with one of the doctors that I worked with in college and then worked with during my year in between medical school, and she was also in Boston. And I wanted to look at the effect of diet on acne and stress on acne. And back then everyone was like, well, there's clearly not a link there, and it's funny to think now to where we are in our society, where people are very much more aware of the microbiome and how what we eat does actually affect our state of being, and does that reflect in our biggest organ, our skin. I think it was a lot of being with you was a safe space for me to be able to fully express my broader view of health and well-being, because when I would try to broach it with some of my other professors who were, more traditional in their thinking, they would kind of just look at me with a little side glance and curiosity and be like, what is she talking about?
So you made it through Harvard Medical School with leading this sort of double life.
Yeah.
I love that idea of the double life.
Yeah.
That's a lot of how I felt while I was in that world too. And then where did you go after you graduated from Harvard?
Yeah, so amidst my clinical time in medical school, where we're supposed to figure out what kind of doctor do I want to be, I think it was honestly seeing a lot of the adult patients and seeing how what they were presenting with all honestly came from either childhood, not all, but a lot of what their health experiences were like as adults really were influenced by what they experienced when they were children, whether it was the habits that they were established or experiences that they had. And as somebody who really believes in prevention, I really felt drawn to pediatrics because it felt more upstream to me, that I could make a bigger impact on an individual's health if I could help them kind of get on the right path when they were children. And I think doing my clinical experiences too, there's just such a light and joy and resilience working with children and their parents that really brought me joy. To be up at 3 a.m. with a sick child was just something that I felt much more called to do. And so that was how I ended up in pediatrics. And then when I was looking at residency programs, I discovered a pediatric leadership program for the underserved at UCSF. And so I went back across the country to where I'm from originally, back to the Bay Area. And there I did, again, like it was much more in the space of really traditional, I mean, not traditional, but conventional medicine approaches to looking at children and their health and well-being. And so in that space, again, I felt like I was still on this path of, okay, I'm still training to be a conventional medicine, Western medicine doctor during that time. But in my pediatrics residency program that I was in, I had the luxury and the really cool opportunity to learn more about just how the health systems that we had were impacting our ability to be healthy. Because I was looking at childhood obesity, asthma, a lot of the attention deficit hyperactivity disorder, delays, all of those things were not necessarily based on an individual, which is part of how we have traditionally viewed how healthy someone is. It's very judgmental. It's like, well, this person didn't make the right choices. But I think as I was going through residency, I came to appreciate there's so much in the system that stacks, it makes it harder for people to make healthy choices. If you're living somewhere where there's no grocery stores or the only food that's affordable is junky fast food, there's a reason why your kid is going to grow up eating French fries and hamburgers and soda versus somebody who lives somewhere where there's healthy, fresh food available. They can actually go play outside and not be afraid for their child's safety. It was really striking to me how that was very geographically and honestly socioeconomically based, especially in the US, where it's a lot harder to be healthy if you live in poverty than if you live somewhere that has more, more wealth associated with it.
And so how did that inform you as you moved through your residency and started to create a life with your husband, Brendan, who we're going to be meeting in a little bit?
Yeah, absolutely. Well, I feel like, first of all, it helps me appreciate the ways in which I take for granted, I think, about my health and well-being. Being with my patients, I appreciate just that a lot of the ways in which I approach the way that I eat or move my body, or even how I choose to spend my time are not necessarily default ways that most people would think to spend or know how to spend their energy doing. Like a lot of parents in clinic will say, oh, juice is healthy, it's from fruit, I should give this to my kid. And it's only by sharing with them about how juice honestly is a lot of sugar and it takes away a lot of the healthiness of a fruit, both the fiber and the vitamins and all the other magical things that are nourishing in fruit that we don't even know about because we haven't studied it with science. It's those little pieces that I feel like I really have come to appreciate that I can share with my own patients.
Yeah, and therefore with your children.
Yes, absolutely. Yeah.
So how did that all evolve? You were in residency at UCSF.
Yeah.
And then what happened?
So at that time, my now husband and I, Brendan, we had met in Boston, and then he had moved to New York for work, and so we were doing a cross-country relationship. And after having done that for 5 years, in the before times when there were no smartphones or FaceTime or anything, we decided we wanted to be together and have a family and a life together. And so we chose to move to Los Angeles. And so after I finished residency, we landed there, got married, and I started first working at a community health center in South LA, which was really socially justice minded and really public health focused. which was a homecoming of sorts for me too, because in addition to both having a broader appreciation for what it means to be healthy, I really also wanted, again, in recognition of the fact that it's the systems and the structures that affect a lot of the decisions that we make. It was nice to be in a community setting and thinking bigger picture, not just about in the clinic one-on-one. And it was actually in that community health center that I really came to appreciate a lot of the energy practice work that I learned from you in terms of being able to clear the energy between patients, just like I was washing my hands. Because then, those days I was seeing 30, 35 patients a day, a lot of whom were in a lot of social chaos, with lots of chronic health problems. And it was by being able to still be with them, but not carry that energy with me, that I was able to see patients like that day in and day out and not get burned out.
Talk a little bit more about that, because that's something that, going back to our experience as professor and student, we talked about quite a bit. Because when you were in the office with me, you were having physical experiences and an aftermath.
Yes.
After the sessions that we would have in the office that were very notable to you and that we talked about.
Yeah, absolutely. Absolutely. And it's something that I continue to share too with my own residents and medical students I work with. Because when I first moved from the classroom into clinics with you, I was really struck by how after an afternoon of seeing patients, I would come home with just a sense of heaviness and needing to be quiet and be by myself for a few hours. And I am naturally more introverted, but what concerned me was just the fact that it wasn't going to be sustainable to have this life where, as a doctor, I'd spend all day seeing patients and then need to go home and just be quiet for a few hours. Thankfully, Brendan and I were doing a Boston-New York relationship at that time, so I didn't have to talk to anybody at home. But, that wasn't my long-term plan, to be by myself in my house forever. And so I remember sharing with you this sense of being worried, honestly, of how could I be a doctor and be a human being if I couldn't, manage this sense of, just having taken on a lot of other people's energy at the end of the day. And that was when you shared with me the practice of, being aware of the energy in our body, of the cords of energy that we share with each other, and how we don't actually need to carry a lot of that energy after we use it. Like a lot of my students, or even my friends now, when I talk about this, I think a lot of people struggle with both being open enough to be empathetic, right, to feel what someone else is feeling, but taking on almost too much of that and then not letting it go afterwards. Because it's not to say that I'm not present, I'm not connecting with somebody when I'm with them, but I think learning from you about then after that interaction, we've both moved on in our lives to other wonderful things. We don't need to keep that interaction, that energy of that cord that we had here. It's just kind of extra energy in the world that's not doing anything. So being able to wipe that slate clean really helped me. Learning how to do that helped me both through getting through seeing patients in clinic, but also just through the day. And I was sharing with you yesterday that even now it's still a practice that I do when I go for my run. I just use that as an opportunity to scan my own body and think through, what am I still holding on to? What are things that I need to let go of? And really using visualizations in my head and the forward momentum of running to be able to release all of that, and then being out in nature, fill myself back up with the gold and green energy of nature and the universe.
That sort of energy hygiene practice is one that everyone can benefit from.
Yes.
Doesn't matter what kind of work you do, any relationship that we have, whether it's with family members, friends, children, someone that you meet very briefly in a grocery store line, we create these energetic connections. And so to think of it as hygiene, as a way of cleansing your energy field is very helpful. I love the image that you gave us of the golden green that comes in as you're running.
Yeah.
And between patients, what we can do is, or if you're going from meeting to meeting or Zoom call to Zoom call, what we can do is some very basic things. What are some examples of things that you've found helpful?
Yeah, absolutely. Exactly. And that's something that I think helps make it concrete for folks is, we are taught to wash our hands in between seeing patients, but nobody takes a moment to just, and this is what I'll do in clinic, is just take a moment to like pause and center myself. If it's especially been like a really chaotic experience with the family, whether their child is very sick or their social situations are complicated, just to take a moment and close my eyes and just breathe, honestly, to center and ground myself before I move on to the next patient, or, to also managing all the residents and the medical students in clinic.
I'm glad you mentioned breath, because breath is such a powerful and always available way of cleansing and creating that energy hygiene space.
Yeah. And to what you were saying, I think I kept it kind of as my clinical practice, but it's really, in the past few years that as I've talked to my friends who are in all different walks of life and spaces, that it's something that we all can benefit from.
So now we're working together in Living Whole.
Yes.
And bringing these messages of integrative health, integrative whole health, to a broader audience than what we can do either one-on-one or even in small retreats. For you, Mimi, what is important about being involved in this project?
Oh, there's so many things, Kathryn. I think the most exciting thing for me is the opportunity to share these tools with others, because I think that there's a huge need for it. I just see my friends who are at all different stages of life. We're all searching for similar ways to help ourselves feel more fulfilled and healthy in our lives. And after residency, I moved into more systems-based work, but I think what I was appreciating about what we do with Living Whole Online is the systems are broken. We were literally just talking about that in so many different levels. And while it is important to also work on policy and government structures and whatnot, it also is really important to empower people with things they can do now, because that kind of change takes a long time. And there are lots of things that you and I, again, like we do them and almost take them for granted. And they're just these wonderful tools that we can share with others.
Yeah, I love how you're framing it. We have it feels like you're talking about, we have three arenas to work with. We have the arena of the individual, the arena of the community around that individual, and then the arena of the system.
Yeah.
And one of the things that I really appreciate about the United States is that there's a grassroots culture there. People in the US have the idea that if I'm an individual and I notice that something needs to change, I can talk about that, and I can find other people who feel that way, and we can create a little grassroots movement that then can have an impact on community and eventually have an impact on systems. I remember when I was a medical student and resident, I met one of the people who's part of International Integrators and Living Whole, who's a mentor of mine, and I regard him as one of the pioneers of the integrative whole health movement in the United States. His name is Bill Manahan, and you can see a number of videos on our website from Bill. But I remember when I met Bill in the 80s, he said to me, Kathryn, anything you think of right now that you think ought to be different is probably not going to manifest for at least 3 decades. Huh. And what he was talking about, of course, was changing a system. Mm-hmm. That it takes, a few decades to change a system. But what can happen in an instant is changing things for individuals. Mm-hmm. And that's really what we're interested in this program, is helping people see, oh, okay, I can do this for myself, starting now.
Yeah, and there's such an exciting opportunity now because people have so much access to information, and I think being able to share this kind of information with folks that make them feel empowered and excited is really cool.
Yeah. Well, I can't thank you enough for sitting with me for this podcast. And we'll be doing part 2 of this podcast in a moment by bringing in Mimi's husband, Brendan, who's a very important part of this team. So thank you so much, Mimi.
Thank you, Kathryn.
It's a pleasure to be with you.